Yeah, so today's the kind of the first deadline in the Transparency and Coverage and No Surprise Act rules for health plans and payers. Um, the milestones for this mandate are kind of threefold. The first is today, which is the release of the machine readable files, or the MRFs, which are data files, data dumps of negotiated rates and out of network allowed amounts for a payer or a provider or a health plan's entire network. These files are really not meant to be used by an end user. These are really specifically for researchers, app developers, that sort of thing, as sort of a baseline data extract of the rates that payers will pay for items and services. Starting on 1/1/23, those data will be added to capabilities that are available in a self-service tool for health plan members behind a login, which will on 1/1/23, which will cover 500 shoppable items and services, allowing user to look for the costs and their out-of-pocket expense for those 500 items and services. And then on 1/1/24, those plans and payers will be required to do that same capability for all items and services that they cover under their benefits. Payers are more motivated to comply with the rules maybe than hospital systems were, for a couple of reasons. At one level, the likelihood of the penalties being meaningful on the payer side are significantly higher. We do know, from interviews and articles written and published, a lot of hospitals made sort of a conscious choice about cost benefit in terms of developing the price transparency data updates versus the penalties that were being applied, and sort of made choices based on that. We work, at HealthSpark and Kairos, we work with, over 100 health plans. In talking with most of those, the intention that we're hearing is everyone's intending to comply with the rules, both now with the machine readable files as well as with the member facing tools going into next year. And transparency is really important for payers. It's an important part of the service that they provide to their members in terms of funding care. 88% of the people that we interview, and consumers, et cetera, are expecting that their payers are going to provide transparency. So it is a member expectation that they have to meet, which is, again, sort of somewhat different than the hospital context. And we do know that a fairly sizable number of people report deferring care because of lack of price information, which, again, can have downstream cost implications for our payers. And so we know that the value of transparency for the payers is pretty high. Again, most payers we know already have some sort of transparency tool and positioning in place. So this really is an evolution of an existing offering, as opposed to something completely net new for most of the payers we work with.